What's up, everybody? It's Dr. Scott with the Full Body Fix. What I want to cover today is some neck rehab, specifically if there potentially is a disc issue in the neck. Now, obviously, I'm going to caveat this right up front by saying you should be working with your trusted provider in your local area. Before attempting any of these, definitely check with them. So here's the big thing. A lot of people will actually have pain in different spots that is actually pointing back to a neck issue. So sometimes that might be numbness, tingling, radiating pain down the arm. Sometimes it's upper mid-back pain that's actually coming from the disc. And so you definitely want to get with your provider to differentially diagnose and make sure that you're actually having a cervical disc issue before engaging in rehab for a cervical disc. A couple of quick pointers. If you have arm pain, but when you move your arm, your pain or symptoms don't change, that's probably not an arm issue or a shoulder issue. If you have mid-back pain, but you have full sort of shoulder girdle range of motion, rotation, flexion, extension of the mid-back without any change in your symptoms, it's probably not the mid-back. If you, however, move your neck and you feel symptoms down the arm or in the mid-back, you probably have a neck problem. So that's kind of the short version of how we start isolating what to actually rehab. What I'm going to show today is a couple of quick drills that are part of my Full Body Fix program. You can get the whole thing at the link in the description. So if you have increase in symptoms with rotation of the neck and limited motion in the neck, one of the things we can actually do is use some of the body's natural ability to calm pain down to try to improve range of motion. That's kind of our first goal in rehab. So what I'm actually going to do is use a band to do a little bit of scapular retraction, which is basically pulling your shoulder blades together like this, like a T-bar pull, T-band pull. I'm going to start doing a few of those just to start engaging the upper back muscles, and then while I'm holding that position static, I'm going to start rotating the neck through range of motion. A lot of times what I'll see with patients is by engaging those lower neck and upper back muscles, you can actually get more range of motion. So we'll do a few to one way, a few to the other way, and then have them relax. And then we'll do a high pull, kind of keeping and locking the other one low, looking away. If you're able to do that pain-free, again, anything that hurts, you're going to stop right away. And same thing, looking away. And that way we can start getting some range of motion in the area that's actually painful normally. That's the big thing with anytime there's a hot disc issue, you want to start getting pain-free range of motion in the area to start getting the body's natural protective mechanisms to calm down a little bit. So a lot of the pain that happens is, that overreaction of muscle spasming. So we're trying to get some range of motion in there without causing that to spasm. Some of the other things you can do is take gravity out of the equation. So I'm going to lie down, take gravity a little bit out of the equation, and start doing some pain-free range of motion as well. You don't have to have a table to do this. You can do them right on the floor. And again, I'm just going to kind of rock to one side, rock to the other. As long as that's pain-free, try doing right shoulder and left shoulder. So seated, that would be lateral flexion, these way. Then lastly, I'm going to check flexion and extension, and hopefully one of those ranges is a little bit better than the other, and we're actually going to drill a good way. So flexion is chin tucked, extension, chin elevated. And if one of those feels better than the other, then we're just going to slowly drill through the pain-free range. What I always tell my patients is anytime there's a sharp shooting pain there, we're going to stop right away. We're just going to the pain-free range, stopping and repeating. We'll do all those about a couple sets of 10 reps. Hopefully that helps you guys out if you're dealing with a neck or upper back or shoulder issue. Help refine that a little bit. It's been Dr. Scott with the Full Body Fix. See you next time.